Welcome to another episode of Just a Minute with Dr. Sandy. So today I'm going to talk to you about what to do if you are a first responder and somebody elderly around you falls. Yeah? Elderly fall reaction protocol 1. So first thing you do is if you're called, you don't rush straight towards the patient. You stand 7 feet away and first observe. Point 1 is observe. You observe if there are any sharp objects next to them which can injure you. You observe if there are any slippery areas around the patient on which you can fall and injure yourself or the patient. And then you observe if the patient is conscious or unconscious. If the patient is unconscious, immediately call emergency and tell them of the status. If the patient is conscious, then you go towards the head end of the patient and ask them to breathe, guide them through it. Take long breaths. Once they are calm, ask them, are you okay? If they say they are okay, then ask them these 4 questions to assess if they have a head injury or not. You ask their name, ask where they are, you ask them to tell your name and your relationship with them. If they answer all 4 correctly, it means that they do not have an acute head injury. Now, next, you have to assess for bodily injuries. So here I have a mnemonic. In a fight against a fall, humans should surely win. Humans hip, should shoulder, surely spine, and win wrists. These are the 4 bones which are commonly fractured in a fall. Now you touch these areas and see if there is any pain, ask them to move it. If they are able to move, then you see if the patient has fallen face upwards or face downwards. If the patient has fallen face upwards, then ask them if they can turn towards the side. Once they turn to the side, put your fingers along their spine and see if there are any painful areas and ask them. If they say no, then ask them to turn with their face facing the ground because it's easier for them to climb up. Once they do this, you bring a chair in front of them and ask them to hold the legs of the chair and prop themselves up to their knees and then sit on the chair. Once they sit on the chair, ask a proper medical history, give them a glass of water, and then immediately call their emergency physician or general physician or orthopedic surgeon and fix an appointment. Thank you. This is what you do when somebody elderly around you falls. Be safe and be well. Signing off.